Good evening, everyone, and welcome to the University of Michigan School of Public Health Graduate Prospective Student Discovery Series. I'm Mary Beth Carroll, and I work as the Assistant Director of Student Affairs within our Office for Student Engagement and Practice. My pronouns are she, her, and hers. I hope that you enjoyed the introduction video sent in your reminder email from Dean Bowman. If you haven't had a chance to take a peek, I highly suggest that you hear that message to our prospective students from him. This evening's programming is going to focus on our Nutritional Sciences department. Now more than ever, the world needs public health, and public health needs people like you. Tonight, we'll talk about the field, program design, and really what life is like at Michigan Public Health. During our programming, you'll have the opportunity to engage with staff, faculty, and we encourage you to ask any questions that you might have via the chat box or through your microphone if you're comfortable. We'll also leave some time for questions at the end too. Here at Michigan Public Health, our mission is to pursue a healthier, more equitable world through education, research, and action. We all work together with compassion, innovation, and inclusion to create a meaningful and lasting impact. When you think about it, public health really is all around us. It's the quality of the air we breathe. It's the flu shot you're probably getting at the pharmacy right now. It's the ethics of genetic testing. It's even the creation of policies that govern our healthcare system. If you hear about something in the news, it's likely that there's a public health angle to it, especially now. So here's the common denominator. Everything we do in public health is about improving the health of people, but at a population level. Now, as a graduate of the University of Michigan, you could become part of one of the world's largest alumni networks. This degree will give you worldwide recognition, no matter where life takes you. As a public health student, you will join a top-rated program with a long-standing tradition of excellence. Our history started back in 1941 when the school was founded. This is where Blue Cross Blue Shield was created, where the National Sanitation Foundation was founded, where even the first Earth Day was held, where the flu mist was invented, and the polio vaccine was proven safe, potent, and effective. The University of Michigan and the School of Public Health have consistently earned top ratings for the programs and the resources that we offer. At this time, I'm going to turn it over to Dr. Kate Bauer. She's this year's admissions chair, and she's an assistant professor of nutritional sciences. Thank you so much for taking the first step to learning more about our great community, and I wish you a great evening ahead. Thank you.
Thank you, Mary Beth. Hi, everyone. We're really excited to see you here, see some of your faces. As Mary Beth said, I'm Kate Bauer. I'm an assistant professor in the department. I also, this is my second year as chair of the admissions committee. So I'm going to talk about what many of you are probably wondering, which is how do I, make myself the best applicant and put together a great application. So we will get to that. So to give you an introduction to our department, we like to say we are a small and mighty department. We are entering our 6th year as our own department in the School of Public Health, but we have existed as part of environmental health sciences for decades. So we offer 46 courses, we have 35 faculty members, we have thriving research centers, and most of our faculty have research programs. And we currently have 86 students. And as you'll see, the MPH makes up the majority of our student body, but we certainly have very thriving and active MS and PhD programs. And we're happy to discuss all of those programs here tonight, even though most of you may be here to discuss the MPH. I want to say, and you'll see this in a second, this sort of small or medium-sized department is one of the things that makes us incredibly unique. We know, you will come to know all of us faculty, even hopefully in this era of Zoom. And it's really personable. Susan and I were just chatting. Most of us respond to student emails within hours or minutes, we are always available to you. I've seen faculty bend over backwards to make this a really great student experience for everyone. So that's something that's really wonderful. So next slide, Susan. So, right, nutritional sciences, you know, in the same way that like public health is part of everything and touches everything in a funny way, you know, nutrition is a really broad topic, and you know, everyone eats, everyone has their health. So, you know, nutrition impacts every aspect of our lives and every aspect of the population's health. Our department is really amazing because we span from basic science. We have people doing, you know, research in mice, animal research, all the way out to food policy. And some of our research strengths are environmental exposures. So how does exposure to metals, or how does exposure to PFAS or other things in the environment affect our growth and your metabolic health, your physical health? We do a lot of work. We have a lot of faculty focused on social and behavioral determinants of diet and weight. So thinking about families, that's my area of interest, thinking about parenting and how we raise healthy children, thinking about the intersection of, you know, eating disorders and obesity and how they really do affect the same people most of the time, and that we have to take both of them into account. You're gonna meet our faculty member Andy Jones later, but he leads our sustainable food system efforts and thinking about how we can create food systems, you know, from production to purchasing to preparation, that are more sustainable. And then we do have, you know, sort of what we think of as our traditional nutritional epi efforts, thinking about genetics, thinking about the role of specific nutrients, and dietary patterns on health. So no matter what your interest is within the nutritional sciences, there is very likely someone in our department who can address those interests and really make your time here a really unique experience. Carol?
Well, welcome everybody. I'm Carol Durgee, Student Services Coordinator for the Nutritional Sciences Department. And we are going to do just a little get to know you. And I am going to add in our chat. Oh, thank you, Susan. So I just wanted everyone to see kind of who's here tonight, or who registered for this evening. So you can see that we always have a wide variety of individuals who apply to nutritional sciences. So students who are right out of undergrad, and then students or people who've already been out in the workforce for a period of years. So I just wanted you to see who is here this evening. But we like to know where you call home. And so what I'd like you to do, if you're comfortable, is to turn your camera on. We always like to see faces, and if you're comfortable with that, that's great. And then I am going to be reading off. We have people calling in from different countries, different states. So again, if you're comfortable, we would love to have you have your camera on. If you would love to say hello, we'd like to hear your voice. Or if you just want to use the emoji, which is down the little reaction button in the bottom, I'll show you. I'm going to give a big thumbs up, just so that we know you're there. And again, if you're more comfortable adding things in the chat, do whatever you feel best. So if you hear your country or your state, please say hello or give us an emoji. So I am going to start with India, Malawi, Saudi Arabia, Pakistan, New Hampshire. Okay, hello.
Hi.
Welcome. Ghana, Costa Rica, Philippines, Bangladesh, North Carolina,
Hi.
Here's David. China. Virginia. Massachusetts. New York.
Who's from Madeline? Oh, we have 2 from New York. I'm from New York.
Welcome. I can't remember if I said New Hampshire, so I'm saying it again. The state of Washington, Texas, Florida. Oh, good. We have some fun ones coming in through the chats. Thank you. Indiana, Illinois, Iowa, Ohio, and then the last one is Michigan.
Hi, everyone.
Hello.
All right.
And
So,
I know
and
some of you are in Ann Arbor now. I see Christine. Allison, are you still here?
Yeah, I'm here.
Yeah.
Oh, good. Okay.
Give
I
me-
know that we could have taken Michigan and said Upper Peninsula, west side of the state, but I just went with that. But if I missed your state, please add it in the chat, or if you want to say hello. But welcome, everybody. We're glad you're here. And I'm going to turn it over to Kate, I believe. And I will be looking at the chat periodically. So if you have questions in there, pop them in there and I'll be answering those for you.
Great. Thank you, Carol. So I'm just going to spend the next, well, I say 8 minutes. Everyone who knows me knows I talk too long. Talking about, first thinking about, what is unique about our nutritional sciences department? Why would you come here to Michigan? And then, as I mentioned earlier, we'll talk about what we look for in an applicant. So you can start thinking about how to put together your application. So one of our most common questions is, what do I do with a degree in nutritional sciences? This may be particularly on people's minds, both, as we have lots of need for public health professionals in the current environment, but also, as we know, unfortunately, the economy is a little rough, and hopefully we'll come out of it in a year or so. So our graduates are incredibly successful. I was looking at another recent statistics, and 90+% of our graduates are employed within a year of graduating, and those who aren't, maybe taking time off for family or something. I've been here 5 years and I've never encountered an experience where someone could not find a job and could not find a job that really excited them. Inevitably, our alumni come back and they're super excited to report to us what they're doing right now. So we just wanted to give you an overview of where our graduates end up. And this is a mix of MPH, MS, PhD. Many of our graduates work in healthcare settings, particularly those who go through our dietetics program. And Susan will talk about our dietetics internship to become a registered dietitian. We have many working for the federal government, the state government. I know we have alumni at the USDA, at the National Institutes of Health. Several go back into academia, nonprofits. You can see the range of things here. So there's really exciting opportunities. And, as Mary Beth said, and it sounds a little trite, but it really is true that Michigan and being a graduate of Michigan opens opportunities. There are the alumni base for Michigan is nothing like I have ever seen. And people inevitably are incredibly happy to talk to you, to do informational interviews, to put in a good word. So it really is an advantage to be a graduate of our School of Public Health, both because of the education you get and because of the network that you then become a part of. Next slide, Susan. So again, why would you want to come here to Michigan? Why, I know probably all of you are considering other nutrition programs, perhaps other public health programs. So what makes us unique? I think one of the the strongest things is that we are a nutritional sciences department in a school of public health, right? So that's somewhat unusual. Many nutrition departments are in more sort of either agricultural schools or life sciences, things like that. So the great thing about being in a public health context is that you are always taught the practical application of the work, right? It's not, you will learn, how you metabolize some nutrients and then learn, well, okay, what is the disease that occurs when you do not have that nutrient? And then how do I develop a public health intervention that could be implemented in a developing country to ensure that individuals get that nutrient? So that whole spectrum from inside the body, the smallest cells, to, again, food policy, public health policy, you will be taught when you come to a nutritional sciences department in a school of public health. Another major advantage is that we have our didactic program in dietetics with the affiliated dietetic internship. So again, Susan will go through the details, but it allows you in 3 years, basically less than 3 years, to complete your master's degree and be prepared to become a registered dietitian. And we also, maybe I'm stealing Susan's thunder, but I think we have about 100% success rate on the dietetics exam. So we are, yep. So we train our students extremely well, and it is never a concern that someone may not be able to pass that exam. So we also offer incredible flexibility. Again, the advantage of being in a school of public health is that you can take courses across the school. You could take courses across the university. We have students take courses in the business school, in the liberal arts college, however you want to think about your future and how to design your degree to get you to that future, we can make it work. And again, that's an advantage of us being a small program. I mean, Susan's door and Carol's doors are literally and figuratively open to chat about, okay, your goal is this. How can we find courses to help you get there? How can we find internship opportunities? We really get to know you and how we can create a path for you that makes sense. We have a massive global health emphasis and a growing global health emphasis. Several of the professors in our department are global health professors. So here at Michigan, we don't have a separate global health department. We integrate global health into the activities of all of our departments. So we have, again, Andy Jones works in Ghana and Vietnam. Edward Ruiz works in Costa Rica. Karen Peterson, our chair, has an ongoing study in Mexico. So there are many opportunities, whether it is to learn about the cultures and the food cultures and the nutritional issues in those countries, perhaps even one day, hopefully visit them, analyze data, many opportunities. Do your summer internship in a different country once, again, we're able to travel. And then, I've already hit on this, the academic advising and the small size of our department go hand in hand. Students ask for an advising appointment with me, and I email them back within hours, and I have a meeting with them within days. And I believe all of our faculty are like that. We have a major commitment to communicating with our faculty and following through and making sure we're getting you what you need. And then finally, we have many student organizations. We have 2 within the Department of Nutritional Sciences that are student organizations that allow for volunteer activities in the community, from learning more about nutritional issues outside the classroom, to our other public health volunteer and organizational opportunities. So we're a small department. Our students do become fast friends. I know, again, in non-COVID times, students have potlucks, students study together, students end up going on spring break trips together. It's really an absolutely wonderful experience, but we also offer you what the University of Michigan offers you, which is massive opportunity. And I'm not going to go through all of the quotes here, but what I did a couple of years ago is I asked our students and our faculty, what makes Michigan unique? And I think you'll see a variety of things from faculty engagement and excitement and passion and community to many of our research strengths. Nutritional epigenetics, diet toxicant interactions. We are an academic powerhouse, right? And I like this bubble in the middle, an interdisciplinary perspective from cells to society. That's what I've been saying. That's what, if you look at the range of our faculty, you know, you go from mice all the way to huge countries, policies, huge populations. So just a ton of opportunities here to learn from the leaders and the people who are really doing the science that is making a difference today. Let's see. Yes, and then finally, and I do see there are a lot of questions in the chat. I think it looks like maybe Carol is answering them, so I won't go off and try to answer them myself.
Yeah, I'm answering them.
Great. So finally, you know, why come to Ann Arbor? I said earlier, I popped in and said I'm a New Yorker. I will tell you, I always say totally transparently, my husband was like, oh my God, we have to leave the East Coast to go to the Midwest. Like, that's not what you promised me in life. But we love it here. It's a city of 100,000. There are restaurants, there are cultural opportunities. The university brings in, you know, all sorts of things that you would see in big cities. It's lovely. You can live in anything from a, you know, apartment downtown. Oh my gosh. And there's like farms. This still shocks me. Minutes outside of Ann Arbor, you will see sheep. I drove my son to a sleepover the other day and I was like, oh my God, sheep, like right in Ann Arbor. So it's really a wonderful place to live, and lots of opportunities. And we will next year hopefully be out enjoying them. All right, so I'm just going to briefly go over what you should do when you apply, because I know that people just on an Apalca farm. Yes, I haven't seen that yet. Sorry, I'm looking at the chat. So where do I apply? So the thing to keep in mind is that our MS and our PhD programs are administered through Rackham Graduate School. Meanwhile, our MPH program is administered through the School of Public Health, and therefore you'll be using the SOPHIS application, which is the application system that allows you to apply to many, if not all, of the schools and programs of public health across the country and beyond. So the important thing to keep in mind is that for all of this, our priority deadline is December 1. That particularly if you are a PhD student, I want to see your application December 1. And so, I think my child is coming up to deliver me dinner, so I should wrap this up. So just look on our website and we try to make it very clear for you which program you're applying to. But regardless of whether you are going through Rackham for the MS and PhD or SOPHIS through the MPH, there we go. This is how my teaching goes most days in COVID time. Thank you. Okay, stop.
No, one more thing.
What? Thank you. Goodbye. This is life, right? COVID life. Okay. Go downstairs. So regardless, all the applications come into us and we evaluate them in our department and on our admissions committee. And I will tell you, we give every application a lot of attention. And we really, the bottom line with applications though, is that we look at applicants holistically. So there is absolutely not going to be one thing that tanks your application. I've had so many students call me, email me stressed. Oh my God, I got, a C- my freshman year. If everything else is looking good and you tell your story to us and you tell us what was going on, that C- won't even be an issue. So we really are looking for strong, interesting people who are going to bring a passion. And however you came to nutritional sciences, you are contributing to our community and to making this a really a wonderful place to be. So thinking about your application, right? Again, you do not have to hit all of these points. You do not have to be perfect. We're not looking for that 4.0. We are looking for a well-rounded applicant. So think about, your academic record. If you have a 4.0, that's awesome. Trust me, it makes it much easier to review your application. I do want to, pay attention to our prereq courses, biology, chemistry, biochemistry, organic chemistry. Hopefully I got them all. Susan might correct me, because you will need to complete, if you haven't completed those prereqs yet, you will need to by the time you matriculate. And the most important thing is, if you haven't done one of those prereqs, write that in the application. Tell us, here's why I haven't done this. I switched majors, whatever it is, and here's my plan to complete that. I'm going to take this course online. I'm going to take this course at a community college. We want to see that you've thought ahead. Don't think that just because you don't mention it that we won't notice that you haven't taken a prereq. Think about your statement. Tell us why nutritional sciences and why Michigan. I know when you're doing a lot of applications, it's easy to just write something generic. But if you talk about, working with this professor would be amazing, or I want this opportunity to learn about X, Y, and Z, that really grabs our attention. It's really wonderful to see. Make sure you have strong letters of recommendation, and particularly make sure that we ask for 3. We really like to see, someone who you've taken a class with and you've gotten to know personally, someone you've worked for, someone you volunteered with. Avoid, the family friend who's the physician. We don't care about that. We want to see your work experience, your drive, your passion, why you want to come here. And again, just be honest with us. Like, I can't tell you how refreshing it is to get an application that's like, you know what, I was really sick, freshman year, or COVID just sucked and I hated online learning, and this is what happened to my grades, but here's how I'm going to overcome that. So, we are happy to chat with you. We like seeing plans and commitment and clarity in your application. Anything else there? Yep, so here are prereqs, and you do need to have them with a C or better. Again, if something happened, if you haven't had time to get one, just let us know, right? And I will also say, sometimes we get people who've taken a course, particularly our international applicants, where maybe some of these topics combined or something like that. Again, the more information you can give us that show us that you have done this course, you've done this prereq through this process, it makes our job much easier. All right, I think I have gone through that. Bottom line is that we want to see all of you. We want to hear your stories. And we want to find a way to have you come and join us. And so hopefully we can make that happen.
Thanks, Kate, for seamlessly pivoting from professor to mom to chair of admissions in this Zoom session. Hi, everybody. My name is Susan Aronson, and I play a lot of different roles within nutritional sciences, but I am here as a member of the admissions committee. I'm also a member of the curriculum committee. I'm your DPD director for those students that are interested in pursuing the dietetics concentration and becoming a registered dietitian. And I also lecture and teach a couple of classes, and I co-teach an undergraduate class with Kate, and we have a lot of fun doing that. So I'm a little bit short on time because I know we have faculty waiting to give their presentation. So I'm going to go through my 3 slides fairly quickly, but know that you have access to all of our emails. I'd be happy. I have office hours on Tuesdays from 11 to 1 Eastern Standard Time. So please feel free to hop onto a Zoom, and I have that in my link and can answer any additional questions. So since we have a majority of MPH students, but some MS and PhD, and then students that have indicated in their questions that they're interested in dietetics, I'm just going to briefly go through all of those 3 broad areas and ask specific questions that Carol can interrupt me with. But every student who's pursuing a master's of public health, whether or not you're in our department or you're in one of the other 5 departments in the School of Public Health, has to fulfill these breadth requirements. And those are basically courses that you're going to take in every other department department other than nutritional sciences. And those are listed here. They roughly add up to about 19 credits. There's always a little bit of flexibility and some change in that. So you're going to be taking courses in biostatistics department, in the epidemiology department, a couple of courses in health behavior, health education, and environmental health sciences. So it gives you a really, really broad exposure to all of these different areas within public health that only strengthen the education you have with your Masters of Public Health. In addition to those, we have these core nutrition courses that you'll take that are listed here. And those are all usually taken, 2 of those are taken within the first year and 2 within the second year. And they really give you the basis for all of the careers that you might be pursuing, like Kate spoke about earlier. So those include a macronutrient metabolism, a micronutrient metabolism. We have a really strong course in pathophysiology of obesity that's taught by Dr. Mancuso, who you will get to know. We incorporate some obesity within some obesity education within the medical nutritional therapy courses too, but this is really a whole semester dedicated to it. And then we wouldn't be a nutritional sciences department if we didn't have a nutritional assessment course. So all students are required in their first year to take a year-long seminar that exposes you to research in the field of nutritional sciences. So not just research in the molecular field, but also, as Kate discussed, we have really a lot of faculty members that have niche areas of interest. You'll be hearing from 2 of them as soon as I'm done. And we invite them and all of our joint faculty to also come and give presentations. So you really learn about nutrition and all different aspects of life. So for those Masters of Public Health students, you will spend the summer between year 1 and year 2 in an internship. Carol Durgy, who's on the call, directs that internship and provides a lot of information. So if you have any questions about that in the future, she's your go-to person. And at the end of that internship, you'll take a course that we call our capstone course that not only incorporates professional advice and leads you, like, gives you the types of skills and the tools that you need to be successful in the job market, but also does like a deep analysis of the experience that you had in the summer preceding this course, because this is a fall of your second year course. And it leads to a poster presentation where you can actually present the work that you did in the previous summer to not only your cohort, but all of the faculty and the staff and the new first year students also. So it's a great opportunity to practice like professional skills and standing by a poster, which might be something that you would be doing in the future at meetings. So you will complement all of these courses that are required with electives. If you are not in the dietetics program and you're pursuing a Master's of Public Health, you will have a lot of room for electives. And you'll find that there are classes across campus, in our department, across the School of Public Health, certificates, other types of focus areas that you might be interested in where you can take all of these elective classes. I'm going to move on for a minute to the MS and the PhD degrees. So I think one of the big things that I want to stress here is the difference between an MS and an MPH, because that's one question that came across in the chat. So the MS degree, the big differences, I would say, so the MS degree is a 32 credit degree. The Masters of Public Health is a 60 credit degree. So right there, you have a difference of about 28 credits. You are taking less credits. Both are 2-year programs, 4 semesters. You're taking less credits in the MS degree because the expectation is that you will be spending a significant amount of time completing the research and the preparation for defending your thesis. So you select a mentor during the first semester after having conversations with various different faculty based upon your research interests and the research interests of our faculty. So, so courses are different. The degree and the depth of research that you will complete is different than the Masters of Public Health. Not to say that Masters of Public Health students won't have the opportunity to engage in research. So instead of taking all of the courses from other departments, that list of courses that I showed in the MPH where you're taking at least 1 course from other departments, here you're only required to take 2 courses in biostatistics and a course in epidemiology. So that is a big difference too. You still are required to take your core nutritional sciences courses, and then you have some options that you can take in some of our other course offerings, really dependent upon what your interest area is, what faculty member you might be working with, what your thesis project is, and your academic advisor and your MS thesis mentor will give you some advice on that. So in pivoting just quickly to the PhD degree, in terms of credits, if we're comparing the 3 degrees across the board, actually our graduate school only requires that you complete 18 credits. You will find as a PhD student within our department, you will probably complete many more than that. You'll be spending most of the first year and a good portion of your second year taking courses. We have 3 different tracks that are very specific to your interest area, and those are molecular and biochemistry track, a nutritional epidemiology track, and a nutrition intervention track. My suggestion for you is if you are a PhD student and you are on this call, that you set up a separate time to speak with me so that I can really go through the nuances and the details of the PhD degree and guide you towards our faculty members who might be able to provide you with additional insight about their research so that you can take the next steps in the application process. You don't have to have an MS thesis mentor identified to apply, nor do you have to have a PhD mentor identified to apply. But if you are in the seeking a PhD degree from our department, it would be wise to start conversations with faculty members prior to and during the application process, because a lot of it will depend upon what you're interested in and if the faculty member is actually accepting PhD students in the year that you're applying. And then lastly, my last slide, and then we will move on to our faculty members, who I'm so sad to say that we are a little bit behind in. But again, reach out to me with specific questions. Many of you are interested in the dietetics concentration. If you're in the MPH program or the MS program, you need to take these additional 17 credits in our DPD concentration. It's a 3-step process to become a registered dietitian. You'll complete the didactic coursework that we'll have listed on sample schedules that we can share with you. You then have to be successfully accepted into a dietetic internship. The majority of our students do apply through a pre-select process to our own School of Public Health dietetic internship that has 30 available slots. I can say that every student who has wanted to complete a dietetic internship has either successfully pre-selected with us or successfully matched in the national match. And I'd be happy to provide you with additional information about that. And we probably in the application season will be holding some form of a webinar so I can give you details on that. Just to give you a statistic, last year we actually had 15 students enter the dietetic internship match, and all of them matched with their first or second choice, and they're all scattered across the country at fantastic programs. The last step in becoming a registered dietitian is passing your registered dietitian exam, which we usually recommend you take about 6 to 8 weeks after you complete your internship. And I'm also happy to report, because of the training that you receive here, which we really feel is top notch, we do have 100% pass rate for students that take that within the first year. We have 2 additional focus areas that are outlined here. Dr. Jones, who's going to be talking shortly, might be able to speak a little bit more to the sustainable food systems. I'm sorry, that's my dog. So I don't have a kid bringing me food, but I have a dog wanting to go outside. And then we also have a very popular certificate in physical activity and nutrition, which we kind of co-lead with the kinesiology department. And there's many certificates that are available through the School of Public Health and through other schools and colleges actually across campus. And we'll be happy to share some of those links with you so that you can read more about that. Carol, is there anything pressing, or can we move on to our faculty presentations?
I think we can move on. Thanks, Susan.
Okay. Okay, so I am very pleased to introduce Dr. Andy Jones, who is an associate professor in nutritional sciences, who shared with us this fantastic slide of his very wonderful family. Andy, why don't you take it away for a few minutes? Sorry, we're running behind.
It's okay. I think the first and foremost, it's important to understand that my kids don't bring me food. I wish that were the case. And I always look ahead to what Kate is doing, and I look forward to that day when that happens. So it's nice to be with you guys all this evening, or whatever time it is where you are. My name is Andy. I've been in nutritional sciences for 7 years now here at Michigan. And my focal area is in the sort of the linkages between food systems, healthy diets, and increasingly looking at how our food systems are contributing to climate change. So I think a lot about sustainability issues within our food systems as part of what I do. I've been involved in a lot of different projects over the years. Most of my work has been focused on or in developing country settings. So in Western and Eastern and Southern Africa, I've done work in the Andean region of South America. And I've worked some in Vietnam and in India as well. So I've worked in some different areas of the world. I've been turning my attention increasingly to my own backyard here at Michigan, University of Michigan, beginning to work with Michigan Dining on understanding ways that they can reduce the carbon footprint of their operations, in particular understanding how student food choices in the dining halls contribute to carbon emissions. So thinking about plant versus animal-based diets, that's a big part of what drives carbon emissions. But for many years, I did a lot of work with smallholder farmers in developing countries, those farmers that have small plots of land and are generally low or middle income families, understanding how their farming decisions impacted their diets and the extent to which the diversity on their farms influenced the diversity of their diets and the quality of their diets. A big issue in sustainable food systems is focused on biodiversity, and agricultural biodiversity is a big component of that. So how do we cultivate the kinds of farms and agriculture that we want to see reflected in our diets? Because we do value diverse diets. So thinking about valuing diverse food systems and diverse farms as well. I worked more in urban context too, looking at food environments in urban contexts, especially throughout South America, understanding how food environments are changing, how markets are changing, and how the kinds of foods that are on offer and different kinds of markets are shaping both undernutrition, but also overweight and obesity, which is increasingly those two conditions are co-occurring in many developing countries now, which is a big challenge for policymakers. And I've done a lot of work as well looking at livestock and fisheries value chains in developing countries, understanding how those value chains provide livelihoods for the women and men who participate in them, but also how they contribute to healthy diets or unhealthy diets, and also towards environmental exposures. Done some work in Ghana for the past several years looking at women who smoke fish as a livelihood and the ways that those exposures from smoking fish contribute to poor health, but also the ways that business for them contributes to their well-being and their diet, their health, their sort of dietary quality. I teach a few courses in the department. I teach a course on, it's called Foundations of Sustainable Food Systems. I co-teach that with two faculty members that are in different units. One is in urban regional planning, one is in the School for Environment and Sustainability. And we sort of an overview course looking at some of the key issues in and around sustainable food systems. We look at it from nutritional lenses, from the lens of agroecology, from policy lens. So we give students a good overview of some of the key issues that scholars in that area think about and policymakers think about. I teach a course on evaluating nutrition programs in developing countries, trying to build evaluation skills for students. How do we design programs and interventions? How do we go about monitoring and evaluating those programs and from all kinds of different angles. So I've been teaching that since I first arrived here. And more recently, I guess over the past, 4 years now, I've been teaching a course on food policy. There's been a strong focus on policy in developing countries, but we do talk a lot about different issues domestically. Next week, we'll be talking about the U.S. Farm Bill. The U.S. Farm Bill has lots of implications for food policy and food systems globally. So it's a big driver of that. So we discuss lots of issues. It's a very student-driven course. We focus teaching really around case studies more than anything. So those are the 3 courses that I've been teaching recently. I've been mentoring a number of students. I've had several PhD students. I had a student that worked with me in Bolivia, looking at understanding the relationship between food environments in Bolivia and consumption of ultra processed foods in several regions of that country, and also looking at how those foods may contribute to shifts in the microbiome, the gut microbiome. I have 2 students right now that are working in some similar but different projects, both working in the Ghanaian context. My student Natalie, who's be finishing up soon, did some primary data collection in Ghana, looking at the way that rearing animals and having livestock holdings contributes to dietary change and also to anemia risk. And my current student, Zach Gerston's also been working in Ghana, looking at fisheries and understanding how fisheries are contributing to diets, especially around fish consumption, and what are some of the drivers of those consumption patterns, and how climate change is reshaping fisheries in Ghana. So that gives you a little bit of a sense of some of the diversity of topics some of my students have worked on. And I do mentor a lot of students outside of public health as well, because my interest in food systems really connect with a lot of the work that's going on around campus with the School for Environment and Sustainability and all kinds of different units. So if you're interested in food systems, it's a great sort of intersectional area. We need more public health folks in the area. A lot of the expertise that I've seen is more coming from folks who are interested in the environment. And it's nice to see folks who are wearing a public health hat come in and who are interested in environmental issues, but also want to bring that health lens to it. So I invite students who are new to always get a hold of me. I've done a lot of work with master's students on a sort of semesterly basis, getting them involved in projects I've worked on, whether it be doing data analysis or doing program management kind of work, doing literature reviews, a lot of different opportunities. So my virtual door is always open, so please feel free to reach out. Maybe I'll pause there.
Thanks so much, Andy. That was great.
Yeah.
I want to be reincarnated and come back as you. Because I find the research that you do so fascinating. So, and also it'd be nice to have 2 little girls to love all the time like yours. So anyway, thank you so much. Maybe you can monitor, I know we're a little tight on time, so we're gonna have to condense a bit. So we probably won't take our 5 minutes for questions, but there might be some questions in the chat that if you wouldn't mind responding to those so that everybody could see the answers, that would really help move us along. So thanks for taking a few minutes out of your evening. We appreciate it. So
yeah, I'll probably drop off in about 10 minutes, but I'll look for questions during that time.
Yeah, please, everybody, I encourage you to send those questions into the chat so that we can get through the rest of our programming. And now I'm going to turn it over to Dr. Kendrin Sonneville, who's an assistant professor in nutritional sciences. We also encouraged her to share a fun photo of some members of her family here. So
the ones that count.
Yeah, Dr. Sonneville has a very niche area within nutritional sciences that we wanted to focus, and she's just a lot of fun to have on these calls. So we're just really glad that you could also take some time away from your little guy to spend a couple minutes with us.
Yeah, I'm so happy to be there. So we did a trial run of our family Halloween costume on Sunday, and I could not help but share this adorable picture of my son Carter / Joe Exotic and my rescue pup Sophie, who is playing the role of the tiger this Halloween. So my research area is focused on eating disorders prevention, and I was really drawn to the field of eating disorders prevention after having worked as a clinician. So I started my career working as a registered dietitian in eating disorder treatment. And why I was compelled to public health is that I just saw a lot of suffering, and I wondered, how can we prevent eating disorders from happening in the first place, which is primary prevention. And then a related topic of secondary prevention of how can we get people resources and how can we get them into treatment sooner before the diseases as entrenched or refractory to treatment as eating disorders often become. And as I began studying eating disorders from a public health perspective, I learned about the eating disorder treatment gap, which is very wide. So about 80% of people with eating disorder symptoms never get treated for their eating disorder. And that treatment gap is much higher than other mental health conditions. Things like depression or anxiety. Folks with those conditions are much more likely to get help for their conditions. So I'm going to talk a little bit about a study that I did related to the eating disorder treatment gap, and then just walk through 2 examples of how students have been able to layer on to my preliminary work to begin to uncover some of these issues related to the eating disorder treatment gap. So there's a long-standing stereotype in sort of the general population, but also among clinicians about who gets eating disorders. There's an assumption that eating disorders affect a certain segment of the population. And we often use the acronym SWAG to describe that stereotype. So skinny, white, affluent girls. That's who the average person might think is most likely to get an eating disorder. What we know is that people of all genders, of all race ethnicities, of all body sizes, and of all socioeconomic backgrounds get eating disorders. And I wondered, might these stereotypes actually affect people's likelihood of getting diagnosed or treated? Might a clinician screen someone who doesn't meet these characteristics differently, or might someone who doesn't feel like they sort of fit the bill or aren't sort of susceptible to eating disorders, might they not even seek help in the first place? So I did a study among several thousand college students from across the United States to understand who has eating disorders, and of those people with eating disorder symptoms, who is most likely to get treated. And my hypothesis was supported. People who met these SWAG characteristics were far more likely to get both diagnosed and treated. And that led me to conclude several things, but that we should probably be doing more screening of people for eating disorder symptoms, because we can't look at someone and know whether or not they may be struggling. And that some of these stereotypes may be driving the disparities and may really disadvantage people who already are feeling marginalized within treatment settings. So people who are seeking treatment, if they are in a higher body weight, if they are not female identifying, if they are not white, they may think, I don't belong here. And it is true that these stereotypes really predict people's likelihood of treatment. So several years back, I was approached by a Master of Science student who was an active duty Air Force officer, and she was completing her MS degree as part of her assignment. And she was interested in what I had studied, this treatment gap, and how this might apply to the military. So she hypothesized that eating disorders might be underreported in military environments. People may be afraid to report because they are supposed to uphold a dominant image and they don't want to be seen as weak. They may worry that it could impair their likelihood of promotion. It could disrupt unit cohesion if they have to, enter into treatment. So she had a lot of hypotheses related to eating disorder treatment gap within military populations, and in fact had never been studied. So she was able to utilize the same data set that I had looking at eating disorder treatment across all college students, and was able to compare likelihood of treatment among civilian versus any military involved students. So veterans, active duty, ROTC, we included all of those in the military involved population. And again, her hypothesis was supported that of those students with eating disorder symptoms, civilian students were far more likely to ever have been diagnosed or treated for their condition. I'll just spend probably 20 seconds talking about an MPH student that I worked with a couple years ago, Kelsey Rose, and she was also interested in this notion of undertreatment and about why people may not perceive eating disorders as serious as other mental health conditions, when in fact they have among the highest mortality of other mental health conditions. And so she is currently leading a qualitative study of about almost 2,000 young people, asking their perceptions about why people are not getting help for these problems. And she's uncovering really interesting themes about how people think that are blaming themselves for eating disorders, that they think that they're volitional and people could just stop doing them if they wanted to. And so again, some more really interesting areas of research are being generated by this study, all stemming from this research question of how can we get people the help that they need. So it's a great example of different ways that students have been able to pursue their own areas of interest within the broader research that I do, which is a niche area, but it's still pretty broad, of eating disorders prevention. And I'll comment there.
Thank you, Kendra. Carter's so much cuter than Joe Exotic. What a creepy eye that is. But I just want to say one thing in reflection to Kendron's presentation of just a small amount of, the work that she's doing, is that when I think about the students, that she just named, who, we all knew very, very well. But, in terms of the dietetic internship, Kelsey was one of those students who knew from the get-go that she really wanted to pursue a career in eating disorders. And we can provide in our School of Public Health internship, maybe a 2 or 3 week rotation if the timing is right, but she wanted more than that. So she really pursued heavily a specific internship out in Boston through Simmons, where she was able to pretty much convince the dietetic internship directors there that even though she might not be what exactly they were looking for, because she was supposed to take additional college courses and she was supposed to do some other hoops that she needed to jump through, that she was their person. And she got matched there, which was just incredible. Very, very, very competitive. I think one of the only eating disorder dietetic internships, and she's had a fabulous experience. So, but that was only because of the recommendation and the work that she did with Kendron, that she could be prepared for something like that. So it's just kind of a unique, we like to follow our students from prospective to admitted to, current to interns, and then out into the world. And she's just a perfect example of how she pursued that. So, so I just wanted to comment on that. We hope that you'll all still stick around, because we have such a fantastic ending here with our students who have been so patient waiting. Kendron, if you wouldn't mind taking any questions via the chat, that would be really helpful. And then logging out, as you see fit, because we don't really have time to pull questions in right now.
Yep.
So thanks for your time, taking it away from your family. We appreciate it. And I am going to turn it over now to Carol Durgee. Kate and I are going to step aside so that you guys can have a confidential conversation with our 4 amazing students who have taken the time to be with us this evening in the middle of a very busy midterm season. So I'm going to mute myself and step away and let Carol lead you through the next several minutes. Kate, you and I, maybe we should hop back on in 10 minutes. Does that sound good, Carol?
Yeah, that sounds
Because I
good.
know we're a little bit behind.
Yeah, but I'm sure prospective students want to hear from our current students.
Yeah, so it's basically 8 o'clock. So Kate and I will pop in at 8:10.
Okay.
Text if you need us.
Okay, thank you. Okay, and I'm going to turn it right over to our 4 current students. You can see right here a little bit about each of them, but I'm going to let them introduce themselves. They will start out with some questions that some of you put into our document, and then I will manage the chat if you want for me to ask some questions, or you are more than welcome, once they introduce themselves, to ask a question yourself. So if we want to just go right ahead and you can introduce yourselves.
Hi, everyone. My name is Arohi. I'm a PhD pre-candidate in the department, and this is my 2nd year doing the PhD. I have a Master's of Public Health from the department as well. And I am originally from Pittsburgh, PA. My undergrad degree was in biology and psychology, and it's really nice to meet you all.
Hi, everyone. I'm so glad to be with you tonight. My name is Allie. I'm a 2nd-year student in the MPH track, and also will be pursuing dietetics. My undergraduate degree was in anthropology and biology. And a fun fact of mine is I am very interested in sustainable food systems, and a lot of that derives from having grown up in rural Colorado, where my family manages a 50,000-acre cattle ranch in partnership with the Nature Conservancy.
Hi, everyone. I'm Elizabeth Zapst, and I'm a 2nd-year MPH student studying nutritional sciences and dietetics. And my undergrad degree was also from Michigan, is in English language and literature, so a little departure from what I was doing before. Fun fact is that I am a 2nd career student, so my background is in pharmaceutical sales, and that's what really drove me to want to approach health from a more preventative measure through nutrition. So I'm excited to see you all and welcome you tonight.
All right. Hi, everyone. My name is Jody Davis, and I am a 1st-year MS student, and I'm currently pursuing the dietetics track. I was born and raised in Jersey City, New Jersey. So shout out to whoever's from New York, because I heard y'all in the beginning. And I wanted to say hi, but hey, to all my East Coast people. So I got my undergraduate degree from Stockton University, which is a very small liberal arts school in South Jersey. And I got my degree in public health and holistic health.
I guess maybe if we should go through some of the questions to begin with. I don't know who wants to start.
I can start, it might be good, and then we can just go in the order that we originally talked in. So one of the questions that I think was submitted is, how is life in Ann Arbor? And I personally love Ann Arbor. It's a great place for graduate students and young professionals. I think the average age is like 26, and there's a lot of young students and families and a lot of fun things to do. I think a few things to keep in mind is that for Michigan, it's a little more expensive than some people are probably used to. That being said, it's definitely more affordable than, I was in Boston before. If you were in California, it's definitely much more affordable than someplace like that. It gets a little cold, but again, if you're from the Midwest, nothing surprising there. But there's just a lot of fun outdoor things to do, which is really important given the situation that we're in with the pandemic. Lots of amazing food, and I think we're all fans of that, given that we're, in the nutrition department. And, just a very warm and welcoming environment, very community-oriented, family-oriented. Lots of fun social things to do with bars and restaurants and things like that. So overall, I'm a fan of Ann Arbor. I think most of the people who come here typically like it a lot.
Thanks, Arohi. So another question was what kind of extracurricular activities we might be involved in, or the opportunities that are available at SPH. So personally, I'm involved in our Student Advocates for Nutrition. I am our garden chair in that organization. We have a little community garden at the School of Public Health that's accessible to all students and not just nutrition students. And so part of my responsibility is working on that garden, which is really exciting. Also, there's Nutritional Sciences Student Association, and a lot of nutrition students are general members of that. And so lots of opportunities like happy hours, talking about internships, so doing internship panels and what to expect your first year. Lots of opportunities to just kind of connect across first year students and second year students. And I'm also part of the Dow Sustainability Fellowship, which is an opportunity that students can apply for. And so I have been working with a group of other interdisciplinary graduate students on a project for a full year. And so we're working with a community in Saginaw and doing a sustainability related project there. So my project specifically is based on urban agriculture in Saginaw and whether that's a feasible approach to vacant land. So that's a really cool opportunity that I have loved to be able to participate in throughout this year. It's a really cool way to meet other students and engage in interdisciplinary work. So yeah, those are a few of the organizations that I'm involved in, but there's a lot of different organizations to be involved in at SPH and across campus. So there's really kind of a fit for everyone, I think.
Another question that came in was regarding internships. So as an MPH student in your summer between your first year and your second year, everyone completes an internship. And with COVID, there were a lot of changes. You'd imagine certain opportunities abroad might have been limited, but people were able to find things here to fulfill the requirement. And I was able to get an internship with Michigan Medicine in the bariatric department, dealing with the nutrition side of things. So I shadowed 3 dietitians remotely. I helped put on workshops for the patients that were either going to have bariatric surgery or had already had it. And I learned about the unique nutritional requirements and for vitamins and minerals that the patients need. I also put together newsletters and recipe booklets, got to sit in on Zoom telehealth meetings with the patients and the dietitian. So I was able to still get experience with that as well as with charting. So despite COVID putting a wrench in some of the internship plans, I was still able to have a really fulfilling experience. A lot of students were able to still do something remotely, and I'm hoping that by the time you guys will be doing this, we won't be dealing with COVID anymore, but just wanted to let you know that the MPH internship you do in between your first and second year is an awesome opportunity. And you have a lot of flexibility to make it be something that you're really looking to have in your program. If you have questions about it, feel free to add it to the chat.
Awesome. So another question that we got was, what has your experience been like taking classes during COVID, and how are you coping? So for me, like on the slide says, like my little fun fact, I've been teaching for about 2 years in New Jersey. So technically I have been like in the classroom, but I haven't been like a student. So this has been honestly a big learning curve for me to actually be the student in the classroom. And then on top of that, my classroom is my bedroom. So it is quite challenging, but the professors are super patient and they have such grace for us during this time. I remember my first day in Biostats 521. My professor said that he has never taught in a pandemic before. So this is his first time and this is everyone else's first time. So to be quite honest, yes, it is challenging, but if you feel like you're struggling in a class, you could always reach out to the professors. They will have extra resources for you. Everyone here is quite accommodating for everyone's circumstance at this moment. So although it is a challenging semester, we're all getting through it together. So yeah. And I saw that we had some questions in the chat box.
Yeah, could one of you answer, somebody's asking about, do students actually work while being a full-time student? So would someone like to take that question? Yeah. If you have a job outside of your class life?
Allie, do you have a job?
I do not. I know that some students do and have taken on part-time work. That was something that I personally found challenging to incorporate into my schedule. But everybody's different. So I do have several friends, and I know of other students that have definitely taken advantage of work opportunities at the school and outside of the school, and they've been very happy with their missions, especially working with faculty members as well.
Yeah, I would agree with Allie. So at the moment, I am currently working. I work in Dr. Bauer's lab as a research assistant, and then I also work with student athletes as well. And for full transparency, yes, it is very challenging. Like Carol said, I would recommend between 10 to 15. Oh, wait. I thought you were saying 10 to 15 hours. Oh yeah, you did say that. Okay. So I would definitely recommend 10 to 15 hours, nothing more than that, because your main reason why you're coming into this program is for the nutritional sciences program, and you don't want to like deter from that path. So of course you can work, but I would just be mindful of not like approaching the 20-hour mark, because it does become quite challenging.
Yeah, I can quickly add that during my master's in this department, I worked typically 10 to 15 hours a week throughout my degree. And then as a PhD candidate as well, you're expected to work 15 to 20 hours, either as a research assistant or a teacher. But that's like how you get your funding as well. And these can be really good learning opportunities, as Jody said, but just remember, especially if it's your first time adjusting to school, cap it to 10 to 15 hours max to start. And that way you can focus on your classes and getting adjusted.
Okay, so I know this evening is just rushing by, but we had talked about maybe some words of wisdom from each of you. I don't know if you want to share a favorite class or any advice you have as prospective students that you wish someone had told you.
I think I would say that you get out of it what you put into it when it comes to taking advantage of opportunities. There's so many things in Ann Arbor, in the broader community, and also in the camp, in the School of Public Health. so really you're here for 2 years. They're going to go by really, really fast. Be sure that you make a couple of close friends that you can chat out with outside of class. I mean, the nice thing about the nutritional sciences department is it's so small that you'll get to know pretty much everyone in your cohort, which is wonderful. Those friendships have been really nice, especially with us for COVID, because we've been able to carry those bonds into being remote. And join clubs, join extra clubs, see what you like, and then kind of pare it back if you have to. But it's been wonderful to see some of the unique opportunities that have come up from something that you might not have been able to take advantage of if you hadn't signed up for, you know, an opportunity in a club. And you can see on the NS student panel slide that Carol created all the things that we're all involved in, and you also have our email addresses there. So if you want to know more about any of that, I know we have limited time tonight, but feel free to email us on any of that.
Yeah, so I'll kind of echo what Elizabeth said to some regard, is that, you know, things do go really, really fast. And it's exciting and it's challenging. You know, there will be times that it will feel very challenging, but definitely like reach out to your friends in the program, reach out to faculty and staff members. I mean, one of the things that I absolutely love most about the nutritional sciences department is the people. The people have like really truly made my experience very special. And, you know, despite all the challenges that we've experienced this year with COVID and, you know, just kind of everything this year has thrown at us, it's really been the people in the nutritional sciences department that have made it special and, you know, make you feel empowered to get through this difficult time.
Yeah, so as a prospective student, you're probably looking at a couple different schools. And I would like to say that, like, this is the advice I would have liked when I was applying to my master's, is that to pay equal amount to like the rigor of the school as you do the culture, the fit. And I lucked out big time with this program because it's a really good program and the culture of the department is so good and so welcoming, and you feel challenged, but also really, really supported and included. And that's something that's really important that honestly wasn't on my mind when I was applying to my undergrad or the master's the first time around. And that is, you know, it can make or break your experience, the culture of the department. So I really love this department. I've felt very supported even through this like remote pandemic experience. And that's enabled me to do really well in my career. So when you're just shopping around in different programs and opportunities, really try to see what you think is a good fit and where you feel you'll be most supported and included. And I would like to strongly advocate for this department because I really do think after having seen like a few different programs that this department is really inclusive and warm and caring, and they want their students to succeed and they set them up for success. So again, pay attention to the program and the classes, but also pay attention to the fit and the culture.
That was beautiful. Yes, I agree 100%. I think I would just say as prospective students, this may be like a scary time for you all, but do not be afraid to reach out to Susan or Carol. I cannot advocate for these two wonderful women so much, only because I remember when I was in your shoes last year, I was like a wreck. At the time, the GRE was required, and I felt like I didn't do as well compared to other people. And I would constantly like reach out to them and be like, hey, do you mind setting up like a quick 10-minute meeting just to talk this through with me? And they would. So I would say use your resources. You have a built-in system already. Feel free to reach out to any faculty members. As Dr. Bauer was saying, everyone is super warm and welcoming. And we ultimately want to see you all succeed. So again, if you have any questions, you could reach out to any of us on the panel, but everyone here is just rooting for you all. And I'm assuming they can't wait to see your applications when you apply. So yeah.
All right. Well, thank you, the four of you, for joining us and sharing your wisdom, and always appreciative of hearing your advice. And yeah, it's good to see all of you. So And like all the students said, they've shared their emails, and you can always contact me if for some reason you don't take it down tonight. But so I'm going to turn, I think Susan and Kate are back.
Yes, we are back. We did log in for the last couple minutes just in time to hear all the warm fuzzies. So
Yeah.
I'm like tearing up a little.
I feel like we're both Elizabeth and Jody, I feel like I know you guys so well. And Allie, we worked together with the Dow Sustainability. And Rohi, I remember when you came like to visit campus and it was a beautiful day. And I said, let's just go for a walk. And I remember walking on campus with you when you were, debating about where you would do your graduate degree. So we don't get to know everybody intimately, but we do really try. So that was very sweet. Thanks for sharing those stories. I wish we had all evening together because there could be a lot more that we could share, but I so appreciate the four of you taking your time out of this. I know it's an incredibly busy week. Some of our hardest classes have midterms this week, so I know everybody's needing to study. So thank you so very, very much. I'm trying to see what we have here. I think we have just we wanted to wrap it up. Kate, did you have any final words? And I mean, I'm happy to hang out on chat and continue to answer questions. I'm happy to, keep this, this open for people that want to pop in with, just, unmute themselves and answer questions. I have another 15 minutes. I could easily do that. So whatever you guys want to do.
Yeah, I'm happy to stay on. Of course, we know, you've given us extra 20 minutes almost, so you are, welcome to go. I finished my dinner while I was off camera, so I can hang out. But yeah, we're just, I think probably what's come shining through is that we are really enthusiastic to meet all of you and to read your applications, and we are open to any questions, however you want to contact us.
This photo was taken obviously pre-COVID times. This was our graduating class this past year, I believe. I think this is the current. There's some current second year students in here. Or was everybody? No, everybody here in it, I think, has graduated except the MS and the PhD students. And this was a moment after we had taken some formal shots where we said, let's be goofy. And some of us, like the person in the back with their hands up in the air, like me, that is, there's a little bit more goofy than others. So, but I think we're a pretty wacky but fun group. So questions? Does anybody have any questions? Please ask away.
So there is a question in the chat here about if classes will be virtual next year instead of in person due to COVID, how much notice will students be given about this change? Gosh, we don't know anything in the time of COVID. So currently, for those of you who are not aware, students, we are having a in-person semester here at Michigan. So a small number of classes are in person. Some classes are hybrid where you can choose to come in person or you can choose to do it distant. I do believe winter term is going to be, there's no spring term here, it's called winter. Well, there is this, anyway, next semester will be the same. And I don't think any decisions obviously have been made about the fall. Hopefully we will have at least a month's notice, I would think. I don't know, Susan, what you would think, because we know you have to work out housing and are you going to come? And so unfortunately, I don't have a better answer.
Yeah, I don't have an answer. I think it's day by day, week to week, and we're not even 100% sure what winter is going to look like at this point. We've been using the term cautiously optimistic for a long time now, and I'm going to be even more cautiously optimistic about the fall semester. So let's just hope we get a vaccine that's got a great success rate that we can get everybody vaccinated. So we never thought it would go on this long.
And there's another question. How do I improve my application and make sure I'm guaranteed an admission? I have a Bachelor of Science in Nutrition and Food Science and an MPH. I'm interested in dietetics program alongside the PhD. So I guess, Rose, if you're applying for the PhD, by far the best thing to do is to look at our faculty and see who you would like to work with. Because the PhD application process, I mean, obviously you have to be sort of academically qualified, and, you know, we look at your experience and everything, but fundamentally it comes down to fit with a faculty member. And even beyond that, if the faculty member has funding, because we do not admit any PhD students unless we can guarantee funding for the period you're here. And those funding packages are generally some research time and some time as a teaching assistant. You know, if a PhD, applying to a PhD is unlike everything else, and it really is about that you want to do the type of research that matches with a faculty member. And I say to everyone I talk to that it's also about timing, because funding is just really hard to, you know, hit at the right time. And if a faculty member had a grant come in, so reach out to faculty. And you can do the dietetics requirements with the PhD. We've had some students do that and integrate their internship into their PhD time. Okay, so then if one pursues an MS nutrition, will they have the same funding opportunities from the public health school as other public health programs? So yes, we sort of equally look at MS and MPH students when we are allocating our dean scholarships. And we also have some funding from private foundations. And some of those are matched to student interests. For example, if you are interested in food safety, we have one scholarship opportunity that needs to be awarded to someone in food safety. If you're interested in maternal and child health, we have a scholarship opportunity for that. So basically between the MS and the MPH, I don't think there's any difference in sort of how frequently or how much we fund people. We really treat those two programs very similarly.
I would just have to add to that, you know, through, obviously there are other funding opportunities through Rackham.
I have a question.
That MS students are, you know, are available to receive that MPH students aren't, but additionally then there are school public health funding. So it really does all equal out in the end. Somebody was just popping on with a question. Go ahead.
So when, hi, so my name is Darius. So when considering the GPA, does cumulative mean each school that you went to, or just the last? It's a university.
We would really look at everywhere you've attended college, taken, or graduate school. You know, so we have traditional students who've been at the same university for 4 years and got their bachelor's. We have ones who've been at community college and have come into, you know, a 4-year school and then maybe taken some other community college courses. So it all counts. And again, if you were concerned, you know, if you didn't do so great freshman year or something, you know, just explain it to us. And oftentimes there's two pieces, right? We understand life happens, stuff happens, right? And so if you're just transparent with us about what was, you know, going on, why maybe that course grade doesn't reflect your true ability, that's great. On the flip side, right, we want people to succeed in this program. So if, you know, you are someone who has below a 3.0, who, you know, maybe had to retake chemistry a few times, we are going to look pretty hard at your application, because we don't want you to come here and, you know, take on student loans and pay a lot of money for a degree that might not be right for you. So again, we are happy to chat about individual circumstances. But yeah, if you didn't do so hot in chemistry and you want to retake it online and show us that you can get that A, go for it. We will pay attention to that.
There's a question here about when will decisions be released if you apply by the priority deadline. So I would have to say that, you know, first in December, we try and review all of our PhD applications. Because we often, I'm not sure exactly what we're going to do this year, but we often will have like we last year called it more of a research day, where we invited MS and PhD students who might be admissible to the program. So PhD is a little bit different in terms of releasing admission information. It doesn't really, it really is so individualized because it really depends upon faculty members that have the ability to take on students. All other students, though, we often will do some review of MS students in December. And if your application is in by the first time we meet as a committee in January, which is usually around the second week of January, we usually review all of those during that week. And if your application is complete and the letters of recommendation are there and the transcripts have been verified and everything has been received, usually we can get decisions out within 2 weeks. So you will probably be hearing if you're within the first batch by the end of January is usually a pretty reasonable. You might have pieces that are missing, and then, you know, Carol will often reach out to say, hey, we only have 2 letters. We need this third one. You know, we might have a decision pending. We just need to see that last bit of information that's missing. Are MS students interested in dietetics concentration also able to obtain global health opportunities and funding for their dietetic internship electives or research? Okay, so this is kind of a multi-level question. So yes, that there are funding opportunities available through, Kate talked a lot about global health and that we don't have a specific department, but we have a global health program that does historically have funding available for international opportunities. As an MS student, you're not required to do an internship between years 1 and 2. Like the MPH students are, but you might be working alongside a faculty member who is doing international work, and some of your research could be involved in site work. That usually happens a little bit more with PhD students. Kate, do you have any thoughts on that?
No, I was not listening to you. I was reading on the question.
That's okay. That's okay. In terms of dietetic internship funding out, if this is specifically about funding opportunities, you know, the dietetic internship funding opportunities usually come from scholarship applications through the Academy of Nutrition and Dietetics, the Michigan Academy of Nutrition and Dietetics, and other local academies, in addition to some scholarship funds that we have throughout our department that you can apply to once you're a student. So I guess the bottom line is MS students who do dietetics concentration have a really full schedule because of the thesis work that needs to be done in addition to the additional dietetics concentration. So I think that's you might want to just reach out individually to one of us and we can talk about the specifics of that question. Do the letters of recommendation have to be received by the priority deadline? No, they don't have to, but we can't complete the review of your application until we receive them. That's probably one of the big things that are outside of your control, but the sooner you have those links sent to those that are recommending for you, the sooner we'll get the letters. And then ultimately it's up to you to kind of nudge those people to get those recommendation letters in. So it's frequent we get like an application that we start to review that only has 1 or 2 letters in it, but then we will nag you so that you can nag them to get the letters in. Decisions. So Carol wrote February, March. You consider courses and grades from a non-degree program as well, not related to prerequisites. Yeah, we do. We look at, you know, like Kate had said, overall GPA. It's kind of fun the way, like, especially the SOFIS application comes to us. It will show us your freshman and sophomore GPA. It will show us your junior and senior GPA. It will, you know, show so we can tell kind of trends with that. And then it will break out all of your courses by subject matter so that we might see social science, natural science, business classes. So it really gives us a whole snapshot. And then we also review the transcripts once they've been verified too.
Yeah, no, I'll just say, so as someone with a social science background, I always love to see too, you know, maybe people did not know they wanted to do nutrition or dietetics very early on, and they've done anthropology or sociology or, so we've had people with lots of different backgrounds. And I agree, it's always, you can sort of see someone's story and someone's trajectory in their materials. And it's really fun to get to know people.
Just to reiterate scholarships, you know, we review all applicants are considered for our department scholarships. You don't have to make a separate application for that. Anything maternal and child related, we make those notes when we review your application.
And I believe like you'll get notice of funding almost always, if not always, after your acceptance letter. So do not freak out, think that you got no funding because that news didn't come at the same time. It's just a two-step process.
Yeah.
There's a couple of outside opportunities also, but we would flag you if we thought that you might fit for that. For example, on campus, there's a Center for the Education of Women, and they have some funding opportunities, not just for women, but they do have some for men also. But in general, we direct students to them. If you are what we would call maybe a non-traditional student, what that means is that you've taken a number of years off from the last time you received a degree, and you've been working or pursuing other opportunities that are not educationally based. So CEW has some nice scholarships that you can apply in those certain circumstances. So, and I think it has to be at least 5 years out of your degree in order to qualify for one of those scholarships. Do we answer everything? And we're going down in the numbers now too.
Yes, and we're at 8:35. So I do feel like
we
don't want anyone to feel like they have to stay on to
prove
themselves.
There's one more question. It says, do you consider courses and grades from a non-degree program as well?
Yes.
Okay. Did you already answer that? Not related to prereqs.
Yeah, I mean, again, it all comes together and we get all of your transcripts. So yeah, we would certainly look if you've, I don't know what the situation would be, but we look at all your grades. We do, again, look at those prereq grades because we want you to succeed. And so if you have struggled with natural sciences, we would probably reach out but everything else looks really good. We'd probably reach out to you and encourage or require you to what's the expression? to maybe retake a course.
Well, thank you everybody for spending an hour and a half with us. We appreciate your time and your energy and your questions. And as we all noted, we're here for any type of additional email questions, or if you want to set up any appointments with us in the future, we'd be happy to talk to you about the specifics of your application.
Okay.
Oh, one more question came on. If you haven't completed any of the prerequisites yet, can you still apply to the program? That's going to be a challenge because many of the courses, especially the chemistry series, is sequential. So it's not like you can just say, okay, I'm in the winter semester. We call the semester that starts in January winter. Other people call it spring, but it's winter here, so we call it winter. So if you said even you were going to take all of those courses, then you can't, because you have to take Gen Chem before Organic Chem before Biochem. So there are some nuances with that. And plus, we really need to see those prerequisite grades to see whether or not you'd be a good fit for success here.
But I think we're always happy to talk and say, okay, if you're aiming for 2022,
right, how
would we recommend you take these courses while you're working or something like that?
Absolutely. Right. Okay, well, thank you, everybody. We hope to see your application. Hope to hear from you and look for more information coming from us in phase 3 of our Discovery Series.
Yeah. All right. Thanks, everybody, for being here.
Good night.
Good night. Yeah, we will definitely send this recording around too when it's ready.
Can we cut Noah out? My embarrassing child. Oh well. Good night, everyone.
Good night.